Hi all, this is GOPAKUMAR and welcome to my channel Hi-Fi Tech. As the world copes up with the impact of novel coronavirus pandemic, I know that you have a lot of questions about what it means for you and the people you care about. Knowing what is accurate can protect you and your family. In this video, I have tried to put together a complete guide on COVID-19, including home self-awareness tests, Ayurvedic remedies, busting myths, whether COVID-19 can transmit to online items. So, without wasting any more time, let's get started. There is a lot of information flying around, and knowing what is going on will go a long way towards protecting you and your family. The information contained in this video is purely research information and is for educational and informational purpose only and is not intended as health or medical advice. Always consult a physician or other qualified health provider regarding any questions you may have about medical conditions or health objectives. Please feel free to pause this video at any point of time to read the article. The outbreak of the new coronavirus, the seventh known to affect humans, began last December 2019, spreading across the world with over 1.3 million infected confirmed cases in at least 184 countries and territories, including more than 74,000 deaths and 2.8 million recovery as of April 7, 2020. Italy topping the list of deaths with over 16,000, followed by Spain with 13,000, USA 10,000 and France 8,900. The outbreak has already placed the world on a public health high alert, while in India the number of coronavirus infected people crossed over 4,800 with over 136 deaths at the time of recording this as on April 7, 2020. What is this new virus? The new 2019 novel coronavirus, also named SARS coronavirus 2, has crown-like spikes that characterizes the family. The coronavirus is a newly discovered viral virus from coronavirus family that causes respiratory disease. Humans have long been infected by coronavirus as it is one of those responsible for common cold. The structure of new coronavirus has multiple parts. Inside the virus lays the genetic coding that allows the virus to hijack human cells and turn them into a virus factory. The new coronavirus family causes illness ranging from the common cold to more severe disease such as SARS and MERS. The disease this virus causes is called COVID-19. The number stands for 2019, the year it emerged. On March 11, 2020, the World Health Organization, WHO, officially declared the outbreak of COVID-19 a pandemic after the disease caused by the new novel coronavirus spread worldwide. The declaration of pandemic came more than a month after the WHO declared COVID-19 a public health emergency of international concern. Please note that a pandemic is the worldwide spread of a new disease according to the WHO. The incubation period. The incubation period of the new coronavirus could be between 10 and 14 days. That is, people become ill between 2 and 14 days after infected, according to most estimates. One report describes a person who became ill 27 days after infected. However, Chinese researchers recently stated an average incubation period of 5.2 days. An early study describes COVID virus pathology was 8 days incubation period, a week of infection followed by hospitalization for 9 days, followed by intensive care for over 8 to 10 days. Fatality periods. A rare piece of good news about COVID-19 is that the fatality rate in people who have symptoms of this disease is about 1.4%. Although that estimate applies to Wuhan, the Chinese city where the outbreak began, it offers a guide to the rest of the world. The WHO talked of 3.4%, but this figure was calculated by dividing the number of deaths by the number of cases. Deaths are highest in the elderly and very low rate among young people. How did the outbreak start? The Center for Disease Control and Prevention (CDC) says that initially cases of 2019 coronavirus are linked to the Huanan seafood market in Wuhan city of China. The outbreak likely started from a spillover incident when the virus was spread from animal to. The disease has since spread from who were sick to others from family members and healthcare staff. Origin of the virus. Influenza virus. The 1918 influenza pandemic was the most severe pandemic in recent history. It was caused by an H1N1 virus, leaving over 500 million people worldwide infected and over 50 million deaths. SARS, Severe Acute Respiratory Syndrome. It emerged in the southern China in 2002 and spread to 30 countries with over 8,437 confirmed cases and 813 deaths. It was thought to be from bat, then spread to civet cats to humans. MERS, Middle East Respiratory Syndromes. It was identified in Saudi Arabia in 2012 and spread to 27 countries with over 2,494 confirmed cases and 858 deaths. It was thought to be from camels to human. COVID-19, the respiratory disease caused by the new coronavirus, has spread to every continent, leaving Antarctica. A study of the virus genetic sequence suggests similarity to that seen in snakes, but the origin must still be verified. How is the virus spread among humans? It transmits through respiratory droplets. When an infected person speaks, coughs or sneezes, according to the WHO, the droplets spread through the air and can land on another person's mouth or nose or possibly be inhaled into their lungs, infecting them. The droplets can also settle on nearby surface like a desk, chair or doorknobs where they can survive for a period. A person can become infected by touching a contaminated surface, then touching their mouth, nose or eyes. Please note that respiratory droplets are heavy and don't travel far in the air. So transmission is believed to occur mostly through close contacts, meaning within 6 feet of an infected person. Symptoms. How does the disease present? Well, from what is known so far, there could be a number of symptoms ranging from mild to severe. Mild cases like fever, cough, shortness of breath, running nose, chest pain, dizziness. Severe cases like pneumonia, kidney failure and even death. Most common early symptoms are fever, 98% cases, followed by cough, 76%, followed by aches, 44%. Diagnosis. How can we tell if someone is infected? The infected person can be diagnosed by a test called PCR. The list of centers from where you can get the PCR test done in India are as follows. Please note that the total cost as on March 23, 2020 for complete PCR test should be above rupees 4,500. Who is most at risk? People who have recently been in high risk countries like China, Italy, Spain, Iran, people who have been in close contact with someone who is infected with COVID-19, people with compromised immune system such as people who have cancer, elderly people, people with chronic medical condition, pregnant women. Treatment. There is currently no specific medication for this virus and the treatment is supportive care. Antibiotics are also ineffective because COVID-19 is a viral infection and not bacterial. If your symptoms are more severe, supportive treatment may be given by the doctor at hospital. This type of treatment may involve fluid to reduce the risk of dehydration with plenty of rest and sleep. Medication to reduce a fever, supplemental oxygen in more severe cases. People who have a hard time breathing on their own due to COVID-19 may need a respirator. To slow the spread of COVID-19, we are being told to wash our hands more with soap and water, or failing that with hand sanitizer. The resulting rush to buy hand sanitizer has led to empty shelves in supermarkets and pharmacies. Hence, here is a quick homemade recipe to make your own hand sanitizer at home. In a bowl, 2/3 cup of rubbing alcohol and 1/3 cup of aloe vera gel. Stir well and pour it into a pump bottle. You can also add a few drops of tea tree oil to give a pleasant scent. Vaccination. There is currently no vaccination to protect against coronavirus and the vaccines are in development. In a press conference on February 11, 2020, the WHO said that a vaccination against this virus could be ready in 18 months. Meanwhile, doctors at Rajavati Hospital in Bangkok, Thailand have used a combination of HIV and flu drugs for the treatment of patients infected with the new virus. While on March 12, 2020, 10 days after Thai doctors' treatment, doctors from SMS Hospital in Jaipur, Rajasthan, India successfully treated an Italian coronavirus patient using a combination of HIV, swine flu and malaria drugs. But the biggest breakthrough news was from America, where on March 14, 2020, the first clinical trial shot on human of coronavirus vaccination began at Kaiser Permanente Washington Health Research Institution On 22nd March 2020, a French researcher has reported a successful trial of a new treatment line for COVID-19 with early tests suggesting it can stop the virus from spreading in just 6 days, busting the COVID-19 myths. With the rise in the number of COVID-19 cases around the world, there is an increase in the myth and rumors surrounding it. Use of mask is a must to protect yourself. The common person going out for work or even at home need not wear a mask. The surgical mask is not even recommended by the WHO for people who are healthy. A mask should be used only for the first 6 hours to a maximum of 1 day, after which it should be not reused. The WHO in their website has clearly given the guidelines on who should wear mask and how to wear a mask. Please check. Wear a mask only if you are taking care of a person with COVID-19 infection or when you are coughing or sneezing. Please note that standard mask cannot prevent you from coronavirus, while a surgical mask don't offer you full protection, while a N95 mask offer you full protection against coronavirus provided if you wore it properly. Those with asthma need not wear a mask too. Pets are at risk too and can carriers of COVID-19. There is no evidence to show that this virus will jump to another species. It is now a human virus, therefore chances of it going to another species is not there. But on March 22nd, 2020, there was a news reported of a second dog in Hong Kong tested positive for coronavirus. It is unsafe to consume fish, meat, chicken and egg during this period. The COVID-19 need a host, that is animal or a human, to grow in and cannot grow in food. Thorough cooking is expected to kill the virus because we know that a heat treatment of at least 30 minutes at 60 degrees Celsius is effective with SARS. The Indian Union Minister recently had confirmed this in a press meeting too. Alcohol or hot water consumption will kill the virus. According to WHO, neither sipping hot water nor consumption of alcohol will kill the virus. Alcohol-based sanitizers kills the virus on your hand, but once in your throat, the virus infects the cell and alcohol cannot help there. Using sanitizer is good as washing your hand. When you are traveling, sanitizers are useful if there is no access to soap and water. But it's always best to wash your hand with soap and water. Sanitizers are made of chemical which kills the virus, but the chemical stays on your palm. So on reaching home, always make sure that you wash your hand with soap and water again. Coronavirus can remain on clothes for 9 hours and exposing the cloth in sun for 2 hours can kill them. This is not true and not proven that coronavirus when it falls on a fabric remains 9 hours. This was a false news published in Facebook. Harvard Health says that the disease is more likely to survive on a hard surface than a soft surface like fabric. From a recent US study, there is now evidence that the coronavirus can hold out for a long time on surface. It can survive for up to 4 hours on copper, 1 day on cardboards and 2 days on plastics and stainless steel. Further, it was found that it can survive on metal and glass from 2 hours up to 9 days, while on aluminium it can survive for 2 to 8 hours only. It's not safe to receive a package from any area where the COVID-19 has been reported. There was a report on March 2, 2020 that COVID-19 can be transmitted to online items even after 9 days, as plastic-made items are more prompt to this. This is not accurate, says the WHO. The likelihood of an infected person contaminating commercial goods is low, and the risk of catching the virus from a package that has been moved, traveled and exposed to different conditions and temperature is also very low. Science says newspapers are safe. You will never be infected through newspapers. Experts say newsprint's porous surface and the ink and printing process makes newspapers sterilized. As per WHO, the likelihood of an infected person contaminating commercial goods is low, and the risk of catching the virus from a package that has been moved, traveled and exposed to different conditions and temperature is also low. Adding to this, scientific evidence is the automatic and hygiene process followed by major publishers while printing their newspapers. But as a precautionary measures, always wash your hand with soap and water before and after reading newspapers and magazines. Prevention measures: keep a mask with you when going out. Wear it when you are stuck in a crowded bus or train. You never know If there is an infected person besides you, always try not to use the same mask for more than one day, as it will catch moisture and it can be prone to catch virus. Wash your hand often using soap and water and scrub for at least 20 seconds or about the time it takes to sing happy birthday twice. Take care to get between your fingers, under your nails and around your thumb and dry. If you can't wash your hands, use a 70% alcohol-based sanitizer for 20 seconds when going out. If in a crowded bus or train or in a lift, apply sanitizer soon after you get out. Stop touching your face. This will prevent you from transferring the virus to your eyes, mouth or nose if your hands have been contaminated by the contact with a surface or a patient. Cover your cough and sneeze with tissue. If you don't have a tissue, cough or sneeze into your elbow, not your hands. If you use a tissue, throw it away immediately. If you feel sick, stay home unless you need medical care. Stay away from people by 1 to 2 meters or 3 to 6 feet, as if any infected person cough or sneeze, the droplet can fall to a maximum of 2 to 3 feet only. If you are stuck in a crowd, turn your back towards them. For few weeks at home, don't use common glass, plates, spoons of your near and dear ones. Keep separate towel, plates, glass, etc. for yourself. Common places at home should be kept clean, like the commonly used study or work table, dining table, chairs, water taps, remote control, keyboards, utensils, doorknobs, bedside, toilets, etc. Tips: use your non-dominant hand, that is your left hand, if you are a righty, for doorknobs, toilets, etc., as it's difficult for you to touch your face with that hand. Avoid handshakes and hugs while greeting people. Instead, use a fist bump or bow, or adopt the Indian way of greeting, Namaste. Thoroughly cooked meat, chicken, fish and egg. Avoid unprotected contacts with live, wild or farm animals. Avoid all non-essential travels. Practice social distancing. The Indian government is already encouraging the public to remain at home unless absolutely necessary. Avoid gathering, crowded retail shops, supermarkets, malls, gyms. Recently, the Indian government and the people of India on March 22nd, 2020 observed successfully Janata curfew to add strength and awareness to the fight against coronavirus. Further, Indian government has imposed lockdown protocol across India to control and fight against coronavirus. Of late, China is containing the spread of this virus by restricting normal economic activities. This includes isolation measures that has reduced the spread and death of people in China since the last 2 months. Ayurvedic remedies. While India's alternative medicine ministry, the Ministry of Ayurveda, Yoga and Naturopathy, Unani, Siddha, Sova, Rigpa and Homeopathy, that is Ayush, has recommended herbal remedies to prevent the symptom of COVID-19 in India. They recommend sipping water boiled with tulasi, ginger and turmeric. At the same time, Baba Ramdev too in his video recently suggested that herbal drink with giloy and tulasi can help to prevent COVID-19. Herbal drink recipe to prepare: take giloy, tulasi, ginger, black pepper, crush them all together, grind them and make herbal drink out of it. Mix it with honey and drink. Giloy is called the Ayurvedic root of immortality. It increases immunity, protects your liver, and effective remedy against fever like dengue and malaria, and it also increases the platelet count. Sunbathing. Research shows us that this virus cannot survive above 27 degrees of heat, as sunlight is a natural disinfectant. Hence, the best way to keep your inner body hot is by sunbathing. That is, keep yourself in the sun for 30 minutes daily. Please note that sunbathing should be done after drinking plenty of water, and the best timing is between 8 am and after 5 pm, as the sunrise at that time are not very harsh. In a recent study, it showed that there is no evidence that the sun exposure kills coronavirus, but there is evidence that virus does not like this heat. Fasting. According to Ayurveda, digestion or Agni is the center to health. The idea of a regular fast is to keep our Agni, that is digestive system, rest. This helps to revitalize and reignite our digestive fire. It also gives the chance for Agni to burn up any toxin, break down stones, remove old tissues and replace cells. Ayurveda generally does not recommend long fast. A one-day fast should be a mild one. On the day of fasting, you should eat small quantities of light food. You should remain hungry in between meals and avoid refined carbohydrates, dairy products, processed food, coffee, alcohol, etc. Here is an example of mild one-day fast. For breakfast, a couple of pieces of fruit, avoid banana and mangoes. Lunch and dinner, try vegetable soup, natural fruits and vegetables. Eat seasonal fruits and vegetables from your region, as these are packed with nutrients necessary for the weather. Add the following food to your daily diet to increase your immune: fruits, nuts and oil seeds, spices, vegetables, grains. Do some mild exercise daily, like Surya Namaskaram is perfect, followed by daily pranayama. These are the exercise that trains the lungs and improves the capacity of respiratory system and directly works on the nerve system. Oil pulling allows complete body detoxification. Oil pulling is the art of taking a small amount of oil and pushing it around one's teeth and gum. While any oil can be used for this, coconut oil is the most popular as it is non-anti-inflammatory and antibacterial ingredient. This process is to be done for 15 to 20 minutes and never swallow the oil after the process is completed. Spill out the oil and rinse the mouth with warm water. Apply a thin layer of ghee to the inner side of the nostrils daily. Put in eye drops or 3 drops of coconut oil in your eyes daily. Sleep well. It's very important part for immunity. You need to sleep for at least 7 to 8 hours for the maintenance of your immune system. Stay hydrated. Drink plenty of water. Stay calm. In addition to your physical health, you should take care of your mental health. High stress level can take a toll on your immune system. Don't panic. Remember, prevention is better than cure. So increase your immunity to prevent the virus entry inside you. Simple COVID-19 self-awareness test at home to know if you have COVID-19. Coronavirus infection will be mild like respiratory viral fever for 85% of the population. Anyone who has a flu or a cold, the first thing to do is to isolate yourself and follow your symptoms. On day 1, you will just feel fatigue and muscle pain. On day 3, you will have a mild fever with cough and itching throats. On day 4, you will have mild headache on and off. On day 5, there can be gastrointestinal symptoms like diarrhea or cramps along with headache, and your fever might be normal or might increase. Patients may have difficulty breathing if they are older or have pre-existing health conditions. On day 6 and 7, more body pain and headaches will reduce. Diarrhea might reduce or increase, but upset stomach will continue. On day 8 and 9, most important days in this test, these 2 days you have to keep monitoring as your symptoms will reduce to lower fever, lower body pain, energy will return, only cough persists with running nose. This means you have resistant virus, your body has formed resistance, your antibodies have formed and you are improving. Please note that on day 8, if your flu has gone worse, say pneumonia, then call COVID-19 helpline and get tested. On day 17, on average, people who recover are discharged from hospital after 2.5 weeks. Please note, you can get yourself tested at the nearest testing lab by contacting the national helpline on 011-2397-8046 or toll-free number 1075. So that's it for this video. Till the next video, this is GOPAKUMAR signing off. Stay informed, stay healthy, stay home and safe. Do watch the next part of this series. Bye.